them. We promised to strengthen service delivery to expanding access to free quality primary health care that prioritizes disease prevention, tackle non-communicable diseases through initiatives like Ghana Medical Trust Fund, popularly known as Mahama Cares. We also pledged to enhance leadership and governance by reforming health financing, developing local pharmaceutical production, and improving the management of our health institution, steps we are actively implementing. More importantly, we believe that compromising on the need for motivated and skilled health workers is not an option. Therefore, we have promised and are implementing policies for their professional development. Additionally, our investment in health infrastructure, manufacturing, and traditional medical research are progressing well. Ladies and gentlemen, by fulfilling these promises, we are building a healthier Ghana, one we are creating together right now. Our government, led by His Excellency President John Dramani Mahama, remains firmly dedicated to providing quality, equitable healthcare for all in Ghana. The Ministry of Health, responsible for executing government health agenda, oversees 26 agencies involved in health service delivery, regulation, training, and financing. Today, I am pleased to share with you the highlights of our key achievements aligned with our government health priorities, the challenges we face, and our plans that reflect the manifesto promises and national development priorities for achieving SDG and universal health coverage goals. Let me start with health financing. One of our main commitments is to guarantee sustainable funding for the health sector. Thanks to the visionary decision to uncurb the National Health Insurance Levy, the National Health Insurance Authority's revenue for 2025 has surged to an unprecedented 9.76 billion Ghana cedis compared to the previous capped budgetary allocation of 6.52 billion Ghana cedis in 2024, a massive increase of 3.26 billion Ghana cedis. This additional funding is a game changer, enabling the National Health Insurance Scheme to expand coverage, enhancing benefits, and strengthen Ghana's progress towards achieving universal health coverage. This is the government fulfilling its promise to prioritize the health of every citizen. Furthermore, with the increased funding to the National Health Insurance Scheme, we have increased allocation for claims payment from 56.2% in 2024 to 65% in 2025. And we plan to increase it to 75% by 2026. As the fund grows, we will ensure that every CD reaches frontline services, providing quality care to all Ghanaians. Not only have we uncapped the levy, but we have also been committed to releasing funds swiftly, and I'm proud to announce that the National Health Insurance Scheme, National Health Insurance claims arrears totaling 603 million monthly basis. In the first half of the 2025 alone, the National Health Insurance Authority disbursed over 1.38 billion to providers, reflecting a system that is stronger, more responsive, and more reliable than ever before. This turnaround demonstrates that we are developing a health insurance scheme that benefits all Ghanaians. Ladies and gentlemen, today, 15.65 million Ghanaians are enrolled in the National Health Insurance Scheme, an increase of about 670,000 from last year's own. What this means is that 670,000 more Ghanaians are now benefiting from health insurance coverage. To address the declining funding of the health sector caused by the exit and budget cuts of development partners, following His Excellency John Dramani Mahama's directive, we also quickly prioritized funds to fill the gaps. Still on financing, we continue to collaborate with private partners to invest in healthcare infrastructure through PPP arrangements. Currently, we have identified a partner conducting nationwide assessment that will underpin our retooling agenda for health facilities. Our biggest asset in healthcare is our people. The dedicated nurses, doctors, allied health professionals, pharmacists, and all supporting staff who serve Ghana every day. We recognize the challenges of over 70,000 qualified health workers currently awaiting employment, but I want to assure you that we are working tirelessly to clear this backlog. In the past 6 months alone, we have successfully finalized the employment process of over 10,000 nurses and midwives, with many more to come. Ladies and gentlemen, I am proud to share that we have taken decisive steps to clear the salary arrears for 321 pharmacist house officers who completed training in 2024, with payment now being processed. While 1,621 qualified pharmacists await permanent employment, we are prioritizing their recruitment as part of strengthening our health workforce. This is just one example of our broader commitment to clearing the backlog across all health worker cadres, ensuring every qualified professional has the chance to serve and strengthen Ghana's health system. To complement government recruitment, we are exploring managed migration and private sector options. Regarding managed migration opportunities, over 13 countries have now expressed interest in recruiting Ghanaian health workers. We are formulating policies to ensure these benefits are fairly distributed to both our health system and our professionals. Furthermore, we are also investing heavily in their professional development and welfare to ensure a motivated and skilled workforce. In this regard, the government has implemented conditions of service agreement with our health unions. Also, in recognition of the skill gaps identified by our health labor market analysis, we are revamping the curricula at training institutions to address population health needs, increasing intake for specialist nursing program, and transforming general nursing school into specialized training centers. We are indeed investing heavily in the next generation of health workers. Over the past 6 months, we have guided more than 40 nursing, midwifery, and allied health college through the accreditation process to offer degree programs alongside their existing diploma courses, a significant step forward for quality education. To improve accessibility, we launched a new admission portal for health training institutions that allows applicants to apply from the comfort of their homes. And ladies and gentlemen, at this point, we inherited a system for recruitment, for admissions, where they will generate codes, and these codes are distributed to the banks. And so you necessarily will have to travel from wherever you are to these banks and then go online, pay, get access to the platform, and register. And that's exactly what we did, including the reduction in the sales of forms. Ladies and gentlemen, this is another good news. And this good news, I know all of you will attest to this good news. I'm pleased to announce that just 24 hours ago, the nursing trainee allowance for both the first and second quarters amounting to 462.58 million Ghana cedis was credited to the account of our student nurses. I hope you all attest to this fact. Yesterday, I saw the jubilation across the country on the various campuses, and our brothers and sisters were excited receiving this money. It's a promise fulfilled. This demonstrates that when we say we support our future health workers, we follow through. Moving forward, we will maintain this momentum to ensure allowances are paid on schedule, because supporting our trainees today means building a stronger, healthier Ghana tomorrow. And it is our expectation that we are going to pay this on monthly basis. Ladies and gentlemen, constructing health facilities and equipping them is critical for delivering quality care. We inherited several critical infrastructure projects, including the treatment and holding centers at Koforidua, Goso, Asamiso, the infectious disease training centers at Pantine and in King Council, and 10 key rehabilitation projects such as Ifian Kwanta Hospital, La General Hospital, Konfanoche Teaching Hospital, and the reconstruction of the central medical stores. In line with the government's promise to continue ongoing health projects, 4 major COVID-19 response initiatives, including treatment centers and staff accommodation funded by government and the World Bank, have been completed across the country over the past 6 months. Now another famous one. For the Agenda 111 initiative, we will prioritize the completion of projects that are more than 70% complete. Our government's resolve is clear to leave no community behind in their journey to excellent health infrastructure. We have also continued to upgrade key facilities, including the Konfanoche Teaching Hospital, Maternity and Children's Block. Hospitals such as Kolebu, Cape Coast Teaching Hospital, and Lekma hospitals have received essential equipment, including ventilators and oxygen plants. These are the tools we need to save lives every day. We remain committed to closing infrastructure and equipment gaps through domestic investment and partnership with private sector. However, there are still gaps. Many facilities need renovations, new equipment, and dependable maintenance system. We commit to bridging these gaps through domestic investment and international partnerships, primarily through private partnerships. Ladies and gentlemen, notwithstanding these challenges, we remain resolute as part of our firm commitment to fulfilling campaign promises and transforming healthcare infrastructure, particularly in underserved areas. The government has released funding to every district assembly to support the construction of at least 2 new CHIPS compounds each year. This investment brings quality health services closer to communities and shows our government dedication to building a stronger, healthier Ghana from the ground. Across the country, within the public sector, we have 6 teaching hospitals, 10 regional hospitals, and over 9,025 primary healthcare facilities, including district hospitals, polyclinics, health centers, and CHIPS compound. There are also several thousands of private health facilities. Together, these form the network of facilities through which we provide healthcare to the people of Ghana. Ladies and gentlemen, we promise to prioritize the response to non-communicable disease NCDs, which cause over 40% of our deaths, and we are on track with that. The Ghana Medical Trust Fund, popularly known as Mahama Cares, is a bold and innovative response to the growing challenge of chronic disease in Ghana. This includes our citizens with diabetes, hypertension, stroke, kidney failure, and cancers. With an annual budget of approximately 3 billion Ghana cedis, it will provide essential specialist care such as chemotherapy services that go beyond what the National Health Insurance currently covers. Funding will be provided by the National Health Insurance Fund, government budget allocation, investments, and generous grants and donations. Mahama Cares demonstrate how Ghana is leading the way in health innovation, ensuring that no Ghanaian fighting a chronic illness is left behind. Ladies and gentlemen, I would like to take this opportunity to express our gratitude to all individuals and organizations that have donated generously. And I also encourage Ghanaians to continue to donate to support our compatriots living with chronic diseases. Free primary healthcare. The Free Primary Healthcare Initiative is making steady progress. We are engaging with relevant stakeholders to design, finalize, implement, and monitor the program. Looking ahead, the initiative has the potential to transform primary healthcare access in Ghana, ensuring that quality services are delivered equitably and sustainably across all communities. Ladies and gentlemen, as we all know, emergencies cannot wait. And you recall when I took office as a minister, instead of the usual courtesies, I was greeted with outbreaks. I mean, meningitis here, cholera there, mpox, and all that. So we cannot completely avoid that, but how to manage it as and when it comes is what is very important. We must respond to them as they happen. It is for this reason that we continue to prioritize emergency services. To strengthen emergency response at the community level, the National Ambulance Service is partnering with St. John Ambulance to establish a pool of community first responders. I want to mention that we have initiated procedures to repair ambulances that have broken down. And in addition, we are also exploring opportunities to expand the fleet. The government of Ghana has demonstrated a steadfast commitment to the health and well-being of our children. This year, we increased the budget for vaccine by 46%. As of today, we have fully paid the country's $24.5 million to Gavi. This prompt payment will help ensure we avoid recurring shortages of critical vaccines, which can lead to outbreaks. By August, we'll receive hundreds of thousands of vaccine doses ready to reach every community across the nation. As we say, investing in our children's health today is securing Ghana's tomorrow. We are not resting on our achievements. The government will continue to prioritize and invest in immunization to protect every child and build a healthier nation for generations to come. Ladies and gentlemen, the government has pledged and remains dedicated to making Ghana a center for vaccine manufacturing. In this regard, the National Vaccine Institute is collaborating with regulatory authority and pharmaceutical industry stakeholders to bring this plan to reality. I'm happy to inform you that one of our private sector partners has obtained market authorization from Ghana's FDA to produce snake anti-venom serum on a commercial scale, marking the next step in our goal to shift Ghana from consumer to producer. We have challenges, no doubt about that. Qualified health workers are waiting for jobs, industrial actions that threaten services, infrastructure gaps, as I've already mentioned, especially in regional hospitals, poor maintenance culture in our facilities and institutions. And we all know that as a country, when it comes to maintenance culture, we actually have a problem. And so in order not to keep repeating the challenges annually, we are fixing the problem. And this is what we are proposing to do. We have instructed all health facilities to ring-fence money, and that money will be dedicated towards the fixing of faulty equipment and the maintenance of the facility in general. And so that's exactly, government cannot continue to buy equipment, and then when it's faulty, we go back to government to look for money to repair them or to replace them. And so that is exactly what we are doing. So all the management of the various hospitals will be tasked to do, and that will be part of their KPIs. Ladies and gentlemen, as you can see, we are tackling these head on, planning and investing prudently. Looking ahead, Ghana's health sector is poised for a remarkable transformation. We are fully committed to making free primary health care a reality for every Ghanaian, breaking down barriers to essential services. Now, the Mahama Cares Initiative is no longer just a promise, it's a lifeline growing stronger every day. When fully operational, it will support our people who are battling with chronic disease in every part of our country. Our health workforce will be empowered through expanded specialist training and meaningful incentives, ensuring our skilled professionals remain motivated and ready to serve. We are clearing the backlog of qualified health workers to fill critical gaps in our system and position ourselves in support of His Excellency, the President John Dramani Maham's 24-hour economy agenda. At the same time, we will scale up our efforts to equip our hospitals and clinics with modern technology, enabling us to provide care that meets global standard. This will catalyze our promise to promote medical tourism. And medical tourism, and we've already started a conversation where we will get other specialists from outside the country, US, UK, India, to travel in the country to come and perform various procedures, and the countries around us will also be aware of this particular arrangement so that they can also travel into Ghana to receive such treatment. Furthermore, we will continue to build partnerships and mobilize resources to strengthen the research and development as well as the regulatory capacities needed for pharmaceutical and vaccine manufacturing, as earlier indicated. Together, these actions are not just plans on paper. They are the foundation of healthier, stronger Ghana today and for generations to come. Ladies and gentlemen, the progress we have made so far is a testament to the dedication of our health teams, partners, communities, and ultimately the government's vision. Together, we will continue to deliver quality healthcare to every Ghanaian. I thank you for the opportunity.